Well, hello, everybody. It is terrific to be back and to see so many people. I think the first conference where I really felt like things were coming back was also an ARM conference meeting on the Mesa in Carlsbad, and it really felt, you could feel the energy, and people wanted to really get together and talk about not only what's happened over the pandemic, but also what we're going to be doing over the next couple of years. So Oxford Biomedica has been previously known as a lentivirus company, product-based company, and we've morphed over the years to become a service-related company as well. And we've also expanded outside of lentivirus, and we're also involved with our partners for both adenovirus and AAV, and I'll get into that in a little bit more detail. And our intent is, as a product company that has now moved into the service business, our intent is not just to make batches. Our intent is really to use innovation and use that innovation from clinical to commercial so that we can get into a place where we're taking care of customers, not only in the rare disease space, but we can move cell and gene therapy into areas where we can help more people. So the company, I'm starting off with something that's a bit of a marketing thing, but those of you that have ever heard of it, there's something called a Net Promoter Score. And it's basically one of the things whenever you go on an airline and somebody says whether you liked your ride or not. And getting above 0 is a good thing when it comes to NPS. And we've scored very highly in this area, and it's really an obsession for us to continue to take care of our customers. And a lot of that goes into how overweight, you would say, for a service company that we have with process development scientists and research scientists and project management. Those three areas, once we start working with a customer, is really important for us. We are fully integrated. We go all the way from design through commercial manufacturing. We've added on AAV capabilities, which again I'll talk a little bit more in a second. And we have, like Helen mentioned, we're also a company that has sites both in the U.S. And in the UK. For us, it's Oxford. Oxford, UK was the basis, and we've grown into Boston now, the Boston area. And then finally, we have about 940 employees. That's quite a big increase from previous years, and it's been primarily driven because we were supporting not only commercial manufacturing for some of our partners, but also that we were engaged with AstraZeneca for the Oxford University vaccine, and so there was quite a big bolus of work that occurred in that. And just today, I couldn't put it on the slide, but our revenue was $143 million last year. That's our preliminary estimate, $36 million in EBITDA. So we're a healthy company. We have cash, and we're continuing to grow. So this is an announcement that came out in March. We announced it in late January, so very quickly we were able to close on a deal that we had with Homology Medicines. And we established a new company that we're calling Oxford Biomedica Solutions that's going to be concentrating on AAV technology. And it will be majority owned and is majority owned by OXB and 20% owned by Homology. And when we put these things together, our lentivirus capabilities that we had already had in place in Oxford, our additional adenovirus capabilities that we brought online to support the AstraZeneca vaccine, we really wanted to move into AAV, and this checked a lot of boxes for us with Oxford Biomedica Solutions and the establishment of this new company. We wanted to move into the US. We wanted to get into AAV. We wanted to work with a company that already had capabilities in place. And I think in the services business, there's kind of two modes that people are going through. One is adding a lot of capacity and the other is really sticking with kind of the development and scientific capabilities, and we're more of the latter. So we were very, very excited about what Homology had done for their own products and how they could then take that capability and now make it available for other people. It was actually quite similar to what we did in Oxford, where we built up a capability for our own products and then we made it available for other people. When you look at the new company of Oxford Biomedica Solutions, it's in Bedford, so just outside of Boston. They do have a platform technology that's already been put in place. There have been 45 successful batches that have been made at the 500-liter scale. So 500 liters is the base scale at the site. They have the capability to pair 500 liters to do 1,000 liters and then bulk those two together for downstream processing. So there are a total of 3 500-liter places in batches that are capable. The manufacturing process has been performed all the way from 2 liters up to 2,000 liters, over 600 times. And we're really excited about some of the data that's coming out from those runs. In the AAV space, for those of you that aren't aware, it is the vector that is being used quite a bit in the gene therapy space now, more than almost double what the other vector systems are. But we have run into CMC-related issues with the FDA recently, to a point where in the fall there was an AdCom meeting where there were a lot of things that were talked about. And so we were quite happy that product that was made at this site for Homology, 2 new INDs have gone through after that meeting to make the increased scrutiny. And so here as an example is a slide of what we have shown at the 2,000 liter scale and how things scale up. And below you can start to see some of the things that people look at when they're looking at AAV products in particular. And so we're quite happy with the percent full numbers that we're getting that are in the high 80s, low 90s, significantly. As we've shown and as we've gone over time, we've seen improvements in host cell DNA and the like. And the other part is that there's also continual improvement in technology. The first 2 systems used a 3 plasmid system. The last construct that we have in purple on the far right uses a dual plasmid system. We're just about to finish up the 500 liter GMP, and when we have that, we'll show that as well. But we are seeing with the dual plasmid system that we get even better purity than we were already seeing with our existing 500 liter batches. And we're quite excited, obviously, for many reasons. Come talk to me during the conference or later, and under CDA we can provide much more detail. We're quite excited about what we have here. So who chooses to work with us? It's been primarily folks that have been interested in our lentiviral technology. So these companies have signed up with us, have licensed the technology, and then we do the manufacturing either at clinical scale or commercial. There are some companies that have come to us and have tech transferred their manufacturing process. As I mentioned, AstraZeneca, but also Boehringer Ingelheim have done that. And then another very important part of the establishment of OXB Solutions in Boston was that Homology is a very interesting company with a number of different clinical products actively moving forward. They did need to maintain and retain a certain percentage of the capacity that we had, not all of the capacity, obviously, but they're our first customer with the new company, and we're very excited to have Homology with us. Some of the things that our partners say they they like, and they obviously all customers don't like everything. We're just like anybody else in that we're always trying to do the best that we can. But first and foremost, I do, like I mentioned before, I think it's that high level of touch that we see with our customers. We do feel that we have a proven capability in the space. We've been able to not only do clinical manufacturing, we've been able to transfer from adherent to suspension processes, we've been able to move to commercial, and we've been able to take that from not only lentivirus capabilities, but over into other viral vectors. And we do have commercial supply. It is a rare place, and I hope it's not that rare in the future, but we have been manufacturing commercial products in the space and have been inspected, and products that we're making are in over the high 20s as far as countries. I think it's actually 30 now. So a couple of case studies, how we helped Novartis. We're just thrilled to have been part of the Kymriah story. I think I heard that yesterday or today is 10 years for Emily Whitehead, and the positive things that have come out of that, not only for her, obviously, but for the whole industry. And we became a vector partner with Novartis, and moved that product. And it really, Novartis was a huge partner for us to take us from what was then really a clinical stage company into a commercial stage company. Once we did that, we were able to obviously take the manufacturing process, commercialize it, improve it, and we were able to do quite a few things for that company, for that product, and we continue to have a very successful relationship with Novartis. Another case study that we could look at, and that was kind of the first wave in the evolution of OXB, was how do we move from a clinical stage to a commercial stage company. The second was more recent, and it was around manufacturing of one of the COVID vaccines, and in a very, very short amount of time, all of you who have been involved from the supply side, from the company side, in creating COVID vaccines knows what a struggle it was to provide this product in incredible timelines that were in place. So just to give an example, we went from month 1 to month 10, and we took basically what was a 5-liter academic process to a point where we had 3 different suites with 1,000-liter tanks, making at maximum capacity we could do a new batch a week. So we really not only went from 5 liters to 1,000 liters, but we also, because of the talented team we have in place, we're able to do capacity intensification and really utilize the capacity to the utmost. Super excited about just 2 of these case studies. Obviously, working with our other partners is important as well. The vaccine is being manufactured in half of the facility that we have here. We have these 4 suites that are capable of 1,000 liters. Right now, 3 of them are at 1,000 liters. The other is set up for our lentivirus manufacturing. Our lentivirus processes, we have these great terms: process A, process B, process C, process D. So process B is our standard suspension process that's being used by a majority of the companies, but we are bringing in a suspension with perfusion process, and a number of our customers are quite excited about that. And we've seen drops in COGS that are dramatic when you can start to get into this place. So we do have plans to fit out the rest of the fallow space at this facility, which we call Oxbox. And at least right now, we're talking about 2,000 liters. We do have fill finish capabilities in the space as well. So just to finish up, we have been inspected by majority of the regulatory bodies. We always learn something new whenever these happen, and they've happened continuously from a number of the different agencies. We're quite excited about continuing to bring in now the AAV capabilities that we have in Boston and provide some of that, the things that we've learned in dealing from a commercial standpoint into the Boston site. So in summary, we're a growing company. We remain very focused on the customer. We have our own products, but I think we've done a very good job of doing this left brain, right brain thing of taking care of not only ourselves, but our customers as well. We're global in both Boston and Oxford. We do cover all of the 3 major vector systems, and we will remain focused on vectors. All of our, I should say a vast majority of the analytics and development and research that we do are in-house, and we are a proven clinical and commercial partner, and we'd love to have discussions with you if you're interested. With that, I'll end. Thank you very much.